Hi, it's Dr. Ronald Lett, CEO of the Canadian Network for International Surgery. For more than 25 years, CNIS has had a capacity building strategy to implement its surgical and obstetrical skills training programs in Africa and the Caribbean. Over the last couple years, we have been looking at succession planning and came to the conclusion our greatest strength is not in Canada, but within our African and Caribbean partnerships. Technology, and particular Zoom, allows the meaningful inclusion of our partners in the management structure. We reestablished ACCESS, the African, Caribbean, and Canadian Committee for Essential Surgical Skills. And that committee, which included partners from all over Africa and the Caribbean, explored next steps. It was agreed that we should expand the CNIS board from that group, and 4 ACCESS members have put their names forward to join the board. It was also agreed that our annual scientific meeting, the Bethune Round Table, which has been rotating around Canada for 25 years, will start being hosted by our partners in Africa and the Caribbean. It's expected in 2024 that partnership and hosting will be done by Addis Ababa. Simultaneously with succession planning, there has been a talk about decolonization of global surgery. And we've come to the conclusion that succession planning is an opportunity for decolonization. So we expect to do these simultaneously as a strategy within CNIS. Dr. Jan Christelaw, our Director of Women's Health, has interviewed the 4 candidates for the CNIS board, and we look forward to their meaningful participation in the management of CNIS as it proceeds into its second quarter century.
Okay, well, very good morning to you, and I was wondering if you could please introduce yourself.
I'm Tsagaza Blaka, a medical doctor by profession. I have specialized in neurosurgery. So currently I'm working as an associate professor of neurosurgery at Black Lion Hospital at Addis Ababa University, which is the biggest hospital in the city.
Species Boniface. I'm an anesthesiologist and epidemiologist. Those are my specialties. I'm the executive director of Muhimbili National Hospital, where I work. I'm also a senior lecturer at Muhimbili University of Health and Allied Sciences. I'm also director of Injury Control Center Tanzania, ICCT. I'm also Secretary General of Injury Prevention Initiative for Africa.
I am Dr. Tracy Baville. I am an emergency medicine specialist. I am the coordinator of the trauma team training course.
My name is Dr. Gladwell Kadesha. I work at the Ministry of Health in Kenya. I am an epidemiologist, but my first degree is in dentistry.
The reason we're having this interview today is because you've expressed interest in being on this board of CNIS. And so I was wondering if you could tell us a little bit about your involvement with CNIS over time.
I came to know about CNIS while I was a medical student. CNIS supported the skills lab in our hospital. So we always pass by the skills lab, like looking at the logo of CNIS.
I've known or I've been involved with CNIS activities since the year 2005. I was one of the reviewers of trauma team training, instructors manual. I was also involved in the international trauma team training.
My involvement with CNIS is truly true trauma team training. Dr. Lett and Dr. Bugis came down and they actually did the trauma team training instructor course. And since then, we have been able to have courses and we've been able to train persons.
And how I became involved in this is because of the epidemiology, where in the violence and injury prevention unit, there's a focus on the prevention of injuries and getting that is from primary prevention all the way to secondary and tertiary prevention. That includes trauma care. I actually gave birth to the trauma care trainings, the trauma team trainings, which we really do collaborate a lot with CNIS on, and currently our focus is on that, including the trauma registry. So in a nutshell, that's how I've come to work and collaborate with CNIS.
You know, when we think about CNIS, as you know, it's always been an organization that's been based in Canada. The board has always been made up of Canadians. And at this point, we're really looking at it and thinking what we need is a more global board, which is how this came to happen. Can you reflect a bit on how what the improvements that you'd see as a result of having a more global board?
If there are partners outside of Canada and specifically in settings like ours, it helps a lot for us to set priorities on how to get the training and also how to undertake trainings. And also it helps a lot, it helps us a lot in planning and also setting priorities.
I believe this will ensure sustainability of the already established CNS programs in Tanzania, which are geared towards improving maternal health, increasing safety, and building local capacity in Tanzania. It will be like increasing the sense of ownership of these programs. It will be ours, and hence that one will ensure sustainability of these programs in Tanzania.
There are some nitty-gritty, there are some small details that are different in particular for every region, every country, and within the countries of themselves, different regions, different areas, different villages, they have these particular, they have particular situations that we would know about. So I think it's giving a little bit more local perspective, and it's gonna be able to give you the concepts that, okay, this will benefit us more than this concept would benefit us.
I think we'd even stand a better chance with resourcing and funding if the outlook of the board is more diverse, and especially if you're going to be saying that you're writing proposals towards getting funding for the global south, yet there's no representation there. And then I think you'd in terms of being successful in the funding, if the board is more diverse, includes the global south, I think that would help in the successful grants or granting. Secondly,
how do you see that helping your country if we can make it more African-centric?
Our training, while I was being trained during the residency, I had the chance to have many collaborations under our training. So we had West to South collaboration. So I had the chance to have many mentors from the Western part of the world. So we benefited a lot. And
the way CNS is perceived as it being an organization for Canadians. By doing that, it will mean shifting it to be perceived as a Canadian to it being global. So it will be perceived as a global organization, and hence it will also increase the sense of ownership, and that will ensure sustainability of CNS globally.
So my thought is that with me being on the board, I'll be not only able to contribute to you getting a local perspective from the countryside, but also I'll be able to advocate for us to know which programs we can maybe tailor to Guyana and maybe the Caribbean at large.
I think the starting is to have more a diverse membership from the board. I think what you're trying to achieve, and I think I'd have I think more if possible, more members of the board actually come to Africa and any other countries where their programs are, and see how things are at the board, so that when they are making decisions, maybe they'd also be making a decision from the point of view of having some experience.
And then, how do you see the future of CNIS changing and evolving?
I forecast that there will be many changes in the years ahead, because now there will be ownership not only in Canada but also in the Greater South. The vision and the mission of CNIS will, I think, in my opinion, will assimilate in locally, and that makes it stronger and also more sustainable. So I see like a bright future for CNIS too.
Yeah. I see a bright future of CNIS. I see myself being involved positively, from being local to being global or internationally.
You see, trauma team training, we're very grateful for it. And because we have seen the difference it makes, I am looking at things like First of Midwives. That course, I think that will make a huge impact because we're really working on our maternal mortality, morbidity. We're trying to decrease mortality rates.
I see the potential for reaching out to other countries. Like, for example, me who's in Africa, I think I'd be a champion for growth in the African region. And also I'd be more involved maybe with potential funders. If there's meetings or initial planning with potential funders, I think I'd want to be in the table when such discussions. I'd have a voice at the table where I'd be making recommendations one-on-one. I think that right now we have to pass through LET for our recommendations to go to the board. So I think I'd be actually there. And
yeah. We've heard the buzzword in the last few years called decolonization. Are you familiar with the discussions that have been going on around that, and as specifically as it refers to CNIS?
There should be a fair representation from the southern part of the world. So I think that's the concept of decolonization, in my opinion. Yeah.
Number one, we have like a representative who is not a Canadian. Board members of CNIS will now perceive themselves as being global or international, because my views from this part of the world will be part of the decision-making process of the board.
So first of all, we are grateful for all of our interactions that we've had so far with CNIS. There are things that we think that we can try to improve on. And definitely we start off by bringing our colleagues over from Canada to train us. And once we can get more trainers, we'll be able to now take, I don't want to say take over the course, but be now able to administer that same course with the same quality, same standard.
So I think the decolonization is a good thing. It's about time it happened. And also in the issues of the recent uproar that is happening, where the representation in meetings is also in key global meetings, is also very much affecting the global south in terms of, first of all, the visa processes for us is very punitive and challenging. And then second of all, in terms of maybe the key speakers or the participants, we might be talking about issues that affect us, but it's being talked through by the lenses of others, not the lenses of the people who have had the first-hand experience.